The tireless work of the frontline healthcare workers in our Georgia hospitals has helped countless patients recover from this ruthless virus. Here is one incredible story.
My first thought after I woke up when she was writing the date, it was April the 20th. And my first question was, did I miss Easter? Okay. Are you sure that's the right date? Mother's Day is gone. What else? I missed my mom's birthday. I just couldn't imagine to what was going on the outside of where I was. Everything had stopped. Nobody's allowed to go out. You can't shop. You can't see your family. Can't see your friends. You had to stay in your own home. Kids weren't in school. They weren't graduating. The world was just like at a standstill. And it was shocking to me. Those are the type things you see on TV, in a movie. No reality, but it was reality then.
2020 came in with a bang. You would see respiratory therapy running in 5 different directions, intubating on one floor, doing a treatment on another floor, running to ICU to help intubate in ICU. The rush of patients was overwhelming.
I decided that I need to go to the doctor. I need to go and get checked. So I was on dive into convenient care, let them figure out what was going on, and go to church, not knowing that I would wake up 72 days later from being in the hospital.
Laconyea was one of our first patients that came in with COVID. She wound up in one of the critical care units and was intubated pretty quickly.
Only thing I had was my nurses and my doctors. And if I didn't have the ones that I had, I wouldn't have made it.
The way the body responds to COVID is something so unique and so different. And so many of them stay on the ventilator so long, we never know if they're going to get off the ventilator or not.
My eyes were open and shut, and I would see things. I saw a red-headed lady with this shield and mask on and a gown. And when my eyes opened, I could hear and I could see. Then I would go back to sleep.
Most of these patients only got to see us from here up. So as they would come out of their coma or they would come off some of the sedation, that's all they saw.
I said, "Is your hair red?" She said, "Yes." I said, "I seen you. I seen you when I was asleep." And she was in shock. She was telling me when she would leave for the day, I would be here. And then when she would come back in, she would be in shock because I was still alive. They didn't think I was going to make it because everything that it was doing wasn't working.
Patients, they didn't respond to the medications that we were given, so we wound up having to change that around, trying to do the experimental medications, anything and everything we could do to get a better outcome. We saw this devastating disease come in and tear people apart, and we had so many patients that just had multiple family members in different rooms and different units. We would lose fathers, mothers, brothers, sisters. I had parents losing children. It was just a bad time.
The first conversation I had with someone after I woke up and was able to start talking was with my son. He attempted to tell me about my mom, but I told him he didn't have to. I already knew.
Laconyea was one of those families that there was multiple family members in the unit intubated at the same time. And unfortunately, her mother passed away and lost her battle.
She died 2 days after her birthday while I was in there.
So many of the nurses would stand by. They would stand with the patient, hold the patient's hand, and we'd stand there as the patient would pass so that they actually had somebody with them.
It wasn't the end for me. If you're able to say I had COVID or I have it, it's not the end for you. The day that I was getting ready to leave, I was excited. They gave me a choice whether to leave at 12 or 12:30. I said, "Look, if you're not here at 12, I'm going to be rolling down the hall in my chair and y'all going to be trying to catch me. As we was leaving and going through the hallways, there was nurses and doctors everywhere, and it was so refreshing to see other people and other faces, and to walk into the arms of my son was my biggest joy.
So people like Laconyea, who had been here just so long and just been on intubators for so long, and we just saw them laying there day after day after day, just wondering if they were ever going to pull through or make it or be able to get out of the hospital, and what kind of quality of life were they going to have after all this is over. To see them walk out, that's absolutely incredible to watch.